Good afternoon, ladies and gentlemen. We're going to talk about clinical communication skills, which I think is most vital of the vitals we do. And why is something I'm going to answer. How we can do it, I'm going to answer as well. What we can do about it, well, I'm going to answer. And who is it going to impact, be it patient or doctors, I'll try to share to the best of my knowledge and skills. I will take a back step now and would like to request one of our friends who has been very nice and kind enough to come and share his personal experience than me sharing via this slide. Because the gentleman is here whose father has expired just a month back. My request to the audience is please do not put any questions to him. It's been very nice and good on him that he has come to share it personally here amongst us. Can I invite Mr. Aman Arora, please?
First of all, thank you to Dr. Chabra for actually taking an initiative to do this. I don't know, there's a sense of skepticism that prevails. And I don't have any medical knowledge to tell this, and I might even be concluded absurd according to medical terminologies. My father passed away a month back due to heart attack. He used to have regular checkups and had never complained of related diseases, diabetes or anything of that sort. He just complained of gas the day when he died. He just complained of gas, and when the home remedies didn't work, my mother, I was here in Delhi, so I really couldn't reach there, and my mother was there with him. So with the neighbor, my mother thought it was important to see a doctor at that hour. It was a later evening. She rushed him to the doctor. My father himself told the doctor of what he had for lunch, the medicines he has been having, etc. And himself was talking to the doctor. The doctor on duty at that hour in the hospital told it on his face that this is a heart attack, which I feel is, not the right thing to do to the patient that way. Knowing my father, I knew he used to be nervous and anxious in such scenarios. He generally used to, my dad was a tax consultant. So when it was March approaching, I remember I see him nervous, and things like that would also affect him. And if you tell it to him on his face that he was suffering a heart disease, and especially when he was going through that thing, I think it psychologically affects. He bit his lips and fainted immediately on hearing this. This might sound filmy, but it's true. And the doctors rushed him to the ICU, but within 30 minutes he was gone. And they finally called it a silent heart attack. I am not accusing the doctor of not treating him properly. They gave the first aid or whatever it was required at that moment. But a little more sensitive approach towards this could have helped. We are all aware of the psychological effect of dialogues on human mind. The doctor's behavior created skepticism and panic in our minds. Perhaps my father could be saved if only he hadn't said it on his face. I understand how demanding the profession is. I have a lot of doctors friends, and I know you guys work at stretch for hours. And I know it becomes tedious, and taking everybody very personally and things like that can be tedious. But with power comes great responsibility. So a little sensitivity there is required. So and especially when the human life is at stake.
Thank you, Mr. Arora, for sharing your thoughts, feelings and emotions with us. And that's why I'm here today for how to do it in a structured manner. Where did we go wrong? Something is not right. And let's see what I can do to help ultimately understand to the best of my knowledge. This is what a doctor says. She's a psychiatry trainee, a 4-year-old experience in total now. Communication is one of the most difficult things we do as doctors and as humans as well actually. Because unlike with practical procedures, you can't fall back on your cerebellum to unconsciously guide you. It's just you and your silver tongue. And sometimes you can feel very exposed. So how was I taught about communication skills when I reflect back upon myself? I was told, just put yourself in the patient's shoes. You will do the right kind of thing, right kind of talking and right kind of treatment. Think that they are your family members. Treat them as you would treat your mother, sister, or your wife. But does that really work? I tried my best, but it was not happening every time. The more I'm growing old, the more responsibilities are cooking up. My mind is involved in my child, my family, my wife, my loans, my holidays. Lots of things keep on going. And ultimately what happens? I forget to put myself in the shoes. So that's not working for me. I don't know if that works for you. That you have to answer. But for me, it doesn't work. So, coming to further to it, what's a good doctor? Who treats a disease, as we all know. And what's a great doctor? Treats the patient. But is that enough? Let's see. What's a good doctor first? This is General Medical Council, United Kingdom. The #1 medical council of the world. Without any doubt. That's what it says. Social skills are no way any less important than the professional and technical skills. And you have to have equally all of them to become a good doctor, as GMC says, to practice in the UK. So, what does Medical Council of India says? At the moment, social skills are not a part of it, but I can share with you the Medical Council of India is regularly visiting to the GMC. They are imbibing a lot of good practices over there. That's #1. #2, what I have witnessed last week, I was invited over there for discussing this issue. I met the whole team which is involved in building up the undergraduate curriculum for communication skills. They shared with me what they have already done, and let me tell you, I was quite impressed. I felt it was quite a robust program with lot of activity, including role play and scenarios, is building up for the undergraduates, nearly ready. They have requested me to give input regarding the assessment things, which I have already partly done, and I'm going to share with them. And I can see that this will be placed in the curriculum within maximum probably 1 year. So the doctors who are going to be trained in a couple of years in the medical college across the country will be well trained in communication skills. So our future is going to be better. But what about the present? And what about the doctors like you and me who are already practicing? Nobody has trained us. Where are we going to go? We need to do something as well. At the same time, we are going to, the faculty members who are going to train these doctors, but we are not trained in it. So it's time we need to reflect and think what we need to do. And that's what I'm going to share and discuss further. How many of you would like to have these kind of home? Please raise hands. Don't tell me you don't want these kind of home. Don't lie. Okay, there are 10-15 people. I'm glad to see that. Oh, very good. Their numbers are increasing further. I can see around 20 people now. Good. We all want that kind of home. But when we fall sick, how many of us want to be treated by a designer doctor? One, I can see that. Great. Well, first of all, we need to know who is a designer doctor. What's the definition of a designer doctor? We are all good doctors here. We want to be great doctors, but the ultimate is we want to be a designer doctor. We go to a designer boutique when we want to buy clothes. We want to go to a designer salon when we want a beautiful haircut when we're going for a marriage. Same way, we want to be treated by a designer doctor. But who is he? He's the one, he's not only treating patients well, but communicating with them also very well, and also treating and communicating his colleagues and members and the lab people and the paramedics or the nurses very, very well. So, you know better where you stand. I leave it to you there. But if you think you want to maintain, if you are a designer doctor or you want to become a designer doctor, the solution is definitely appropriate communication. And why? Because when we were born, who did we learn the communication from? Our parents, our environment, our school, our surrounding, our friends. And none of had the same basic structure. We all had different varieties of background. So, our communication styles are different, our understandings are different. Some things we have learned from friends, some things we have learned from mistakes of others, some things we learn from our mistakes. So that's why we need a structured training in that, and that's important, and that's what we will be dealing with further in the presentation. Like we have MBBS training, we need training in communication. So at this point, I will end the module 1 and open it for question and answers.
So what is the curriculum in UK as far as communication is concerned? How many hours they are taught, or is it part of every part of the English communication?
The curriculum starts from the MBBS level now. There are number of hours I cannot definitely say how much they put in, but MCI is planning to put around 30 to 40 hours per year, as I am aware. Because actually I am not dealing with the medical school level, I am training from internship year 1 and 2 level. For them we do around 5 workshops per year, which is mandatory, recognized by the deanery, and the attendance goes there, and that is the kind of workshop we'll be doing in the end of the session today. So we do around 5 workshops for internship year 1 and internship year 2. That's what my involvement is at the moment.
Which specialty will be teaching this? Who will be the faculty or?
Everybody. Depends on your interest, and you will realize whether your interest is not when we talk about Harman brain dominance in the end.